Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Navigating oral care for children with asthma presents a vital yet often neglected aspect of their overall health journey. While asthma management rightfully prioritizes respiratory wellness, its profound impact on oral health often slips under the radar. From the repercussions of medications to habits like breathing issues, a myriad of factors influence dental well being. Join us in this session as we delve into the unique challenges and innovative solutions essential for maintaining optimal dental hygiene in children with asthma. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and today we'll discuss oral health management of asthmatic children with Dr. Shivani Singh Mehta, who will help us explore evidence based strategies for promoting oral health and overall well being for these children and their families. Dr. Shivani Singh is a dedicated pediatric dentist and dental in charge at MGM Hospital and Research Center in CBD Belapur, Navi, Mumbai. Dr. Shivani is highly experienced and skilled in providing top notch dental care specifically for children. Dr. Shivani stresses the importance of milk teeth in a child's development and aims to educate parents and carers about their significance. She also highlights the need for proper dental care to maintain healthy milk teeth. Moreover, MAM is highly dedicated to promoting children's oral health and prioritizes the overall growth and well-being of every child under her care. Dr. Shivani, THIP Media welcomes you, ma'am.
Thank you so much, ma'am.
Ma'am, as you are well aware that kids with asthma might have certain oral health concerns. Right?
Yes, they do. And being a pediatric dentist, kids with special needs, whether it is physical or medical, everything needs to be considered, and very specific measures need to be taken in treating these patients.
Right. So I'm going to start this discussion with the most basic question that how does asthma affect oral health in children? What I mean is that what are the common pediatric oral care challenges associated with this condition?
So let me start with explaining basically what asthma is. Asthma is a condition, it is a chronic condition of inflammation of the uh, bro it is the chronic inflammation of the bronchiole, basically, where breathing becomes difficult. The symptoms which are most commonly found in children are that the children will start coughing, they'll have wheezing sounds while they are breathing or exhaling specifically. They'll have very difficult breathing patterns, and this doesn't happen once or twice, it recurs.
Right.
So this is how we basically dedicate a person that the person is having asthma.
Right.
Now, when it comes to asthmatic children, what basic oral findings that we see in these children are, first of all, since these children are on medications, there is a lot of effect from the medications which causes dryness of the mouth.
Right.
Because there is dryness of the mouth, following consequences come in, like there is a lot of caries. Since the mouth becomes dry, there is less amount of saliva which is forming, which results in increased amount of streptococci and lactococci bacilli, and in return it results in caries. Secondly, there is gastroesophageal reflux in these patients, because
Okay.
of which there is increased amount of acidity in the oral cavity resulting in erosion. These patients tend to breathe from mouth more. Okay, so because of that you'll find structural changes in the oral cavity similar to those found in the mouth breathers. Like you will have adenoid faces, the palate will be high arched, there will be crossbite in the posterior region of the jaw, there will be open bite in some cases. So flaring of teeth, these are some few dental related findings that you see. Now when you come to periodontia, the gums, because of dryness of the mouth, will also be inflamed. So gingivitis, periodontitis is also common in these patients.
Okay. All right. And since you just mentioned that it is, the condition of the bronchiole, it's an inflammatory condition. So these kids will be on medication, right?
Yes.
What can be the oral health side effects of asthma medications? And are there any other factors that could worsen oral health in children diagnosed with asthma?
So mainly the route for administration of these medications in the patient with asthma is oral route.
Okay.
Patient consume the medication in the form of inhalers or nebulizers, or to control the cough, there is cough syrup given specific pediatric patients. So when it comes to the nebulizers and the uh, inhalers that is there, both of them causes dryness of the mouth. Okay. And when it comes to cough syrup, specifically those made for the children, are very sweet. They have sugar components which ultimately results in decay of the tooth.
Okay. Right. And I mean, when should parents schedule dental appointments for children with asthma? And how often should these checkups occur?
Okay, so the attacks of asthma are more frequently seen in the morning sessions as well as in the evening sessions. So, the preferred timings for a dental appointment, which parents should consider, even the dentist should consider while giving an appointment, the preferred timing is of that of an afternoon.
Oh,
Secondly, you should also ask the parent if there is any specific time where the occurrence of this attack is more,
oh,
so one should avoid that time. Some kids they get attacks in school timings, okay, because there
okay,
is a lot of activity that is happening. So even though the school is not working on that particular day, but the tendency of the attack to come in that particular duration increases. So one should avoid that timing for appointments.
okay. And once the child reaches a dentist or the parent approaches a dentist, so what strategies do dentists employ to address oral care challenges in children with asthma?
First of all, I would like to mention that it is extremely, extremely important for patients who have asthma to make regular visits. Okay. Because the problem with these kids is if the attack is severe, okay, or the patient has had a higher frequency of attacks, treatment in dental is very difficult for these patients unless their attacks goes down. Okay.
Oh,
Acute exacerbations cannot be taken into consideration for dental treatment. So whenever a patient approaches, the parent approaches, first and foremost, the dentist should take thorough history, which should include what medication the patient is taking, how frequent are the attacks, and also um, uh, just a minute, okay, how frequent are the attacks, what medication they are taking, and what are the durations of attack, how the parent manages these attacks. Okay. Secondly, having a consent from the physician or the pulmonologist of the child is extremely important. See, there are various materials that we use in dentistry. There is there is materials used in filling materials. We have a lot of air dust particles which are produced. There is mist which is produced. All these can form as triggering factors which can start the asthma attack. So in
right,
order to reduce the tendency of an attack in the dental clinic, one must be aware what are the triggering factors which the child already has, or is
right,
the child allergic to any of them. So,
right.
first and foremost, again, like I said, physician consent is of utmost importance.
Okay, right. And would you recommend any specific oral care routines or products for children with asthma to prevent dental issues?
Okay, so when oral health care for these patients is considered, like majority of the children, they should also follow normal oral hygiene procedures, which
Okay,
include use of fluoride dentifrices or toothpaste, followed by rinsing of their mouth. Okay. Now,
right,
when they are taking inhalers or nebulizers or cough syrup, even for that matter, one should rinse the mouth thoroughly so that the amount of drug in the mouth is reduced. Okay.
okay,
And regular dental checkups,
Right.
that will aid a lot.
Okay. And I think you just mentioned that these children, they have a tendency of, mouth breathing. They develop this particular tendency. So does proper hydration play a role in maintaining oral health for children with asthma?
Yes, like I said, mouth breathing will ultimately result in dryness of mouth. Okay, you can consider like when we are sick, we have sneezing or cough and cold. We also tend to have dry oral cavities, right? What
Right.
is most suggested is warm saline rinses at that time. What it does is basically it hydrates the oral cavity.
Okay.
Not just oral cavity hydration, but the hydration of the whole body will also assist in limiting or reducing the chances of asthmatic attacks. Hence, hydration is extremely important for these kids.
Okay. And are there any particular dietary considerations or restrictions that parents should be aware of to support optimum oral health in their children with asthma?
Uh, these children usually have a number of allergies. Okay,
Okay.
one must consider if the child is allergic to some or the other agent, and that must be avoided. Secondly, inclusion of high fiber diet helps the children to reduce oral cavity related issues. Okay,
Okay.
so whenever we are providing the child with meal, make sure there is sufficient amount of fiber included. One should also avoid in between snacking. Like
Okay.
for any other child, in between snacking may affect the oral health. For cases of asthmatic children, this increases owing to their medication as well as their breathing patterns.
So binge eating is one thing that children with asthma should avoid.
Yeah, binge eating, eating in between meals,
Okay.
which is like really common. One had an attack, now they are calmed down. People, just to make them relax, often offer some food. Okay,
Okay.
they once they are out of their attack session, they'll offer food. You know, you just calm down, you relax, and then you can get back to your work. So these
Okay.
things can be avoided. Or whatever we are offering, that food material can be chosen carefully.
Okay. Right. So, just summarizing everything, can you guide parents on how to educate their children with asthma about the importance of oral hygiene and encourage them to maintain good oral care habits?
Uh, and unlike any other child, even asthmatic child is a child. Okay, we
Right.
need to train them. Huh?
Okay.
Everything comes with practice and reinforcement. So parents should make sure that the child is brushing twice. If we can just put forward towards the child that your dental treatment might become difficult if you fell into some problems with your oral cavity, you can prevent it by doing some basic things like you can brush twice daily. That is one in the morning, one at night. You can rinse your mouth. Following these small steps can prevent future problems for you. So reinforcement becomes the key for any parent like this.
Okay. Dr. Shivani, we're very grateful for your presence today, ma'am. And I'm hoping that this discussion will promote successful oral health management for children with asthma. So thank you so much for joining us today.
I'm very thankful for you to invite me here and let me share my knowledge towards the topic. And I expect these words to help all the needies.
Thank you so much, ma'am. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates and do follow Dr. Shivani's advice. So thank you once again, ma'am.
You're welcome, ma'am. Thank you.
Thank you.